All right, and it looks like we are live. Thank you everyone for being here tonight. I will be your host. My name is Dr. Chad Kuntz. I'm a sports physical therapist, and tonight I have the pleasure of walking you through how we can help you continue to keep running without knee pain, even for those of you that are getting older into your 40s, 50s, and beyond. Let's go ahead and just kind of jump right into this. So again, my name is Dr. Chad Kuntz, and these credentials, it just means I'm board certified as an orthopedic specialist, a sports certified specialist, a strength and conditioning specialist, and I am a huge advocate to helping people get stronger throughout the course of rehabilitation. I'm a sports nutritionist. I have some background in some specific golf training and USA weightlifting. So just to give you guys a little bit of background about me, I've come from an orthopedic residency program after I received my clinical doctorate as a sports physical therapist. And the orthopedic residency program was fantastic. I did it out in AT Still University, out in Phoenix. And it's just a wonderful time for me to fine-tune my craft. And specifically, I was able to work with a lot of runners, a lot of those who just consider themselves athletes, especially as they've gotten older, and quite a few handfuls of triathletes and really serious runners, even 55K, 90K, super long distance runners. And obviously I worked with a ton of even those who are just trying to get running again. And I think that translates well with COVID. Gyms having been closed for a long time, people were stranded. They couldn't really do anything. And so people just started to do even walk to jog, walk to run programs. And so some of you might even be here tonight just because you're trying to get overall active again. So you don't necessarily have to be a super intense runner just to be watching this and get value tonight. And one little cardinal rule that I think you guys should really know about, it's you have to be fit to run, don't run to be fit. And a lot of you who maybe just got started to running, you need to understand you really do have to be strong, and that's a cardinal rule that I kind of tell each and every one of my runners. Oh, so for those of you who are here tonight, have you ever been told that you should stop running? Let's just see. Yes, it looks like a lot of you. I'm getting a lot of yeses with that. Yes, yes, yes. And in addition to that, is running, have you guys been told running is bad for your knees? And absolutely. We hear these kind of things all the time. And so tonight I want to kind of walk you through some of my angles on how I can continue to help people despite maybe doctors or other medical professionals that have told you that maybe you shouldn't be running anymore. And before we can tell someone that they should not be a good fit for running anymore, I just want to give you an idea of just some of the things that need to be checked off before we can come to the conclusion that you should not be running anymore. And in this online education workshop tonight, I want to really, help those who have tried everything, who've gone and seen a physical therapist or two already, who have tried working with a chiropractor. You might getting routine massages. You might have tried hyaluronic injections, or what you might hear as viscosupplementation, which didn't work out for you. And some of you have even had corticosteroid injections, meniscal, surgeries, meniscectomies, ACL history of, hurting different types of collateral ligaments like the ACL, the MCL, or some of you might be here tonight with a total knee and wondering if you can get back to running. So if you feel like you've checked off some of those boxes of what I've just said, and you're interested to continue to keep running, I'm really excited about what we've got going on tonight. And I want to kind of really challenge your brain and your thought processing about your ability to get back out there and keep running without specifically knee injuries. And tonight we're going to just kind of show you a little bit about how we might approach it and how we've had great success helping people continue to run, even if they've tried so many things before. So for those of you that are here tonight, I wanted to start to pick your brain by some, 3 different categorical thought processes of, have you considered these things yet? And have you checked off these boxes? Let's see what needs to happen to help you get back to running. So some external factors that we might talk about. What surfaces are you running on? How much mileage per week? So typically I like to only progress about 10% per week. Some people are making big jumps from 10 miles a week to 30 the next week. That alone could cause knee pain. Proper shoe wear. We'll show you a little bit how often we like to change shoes, what type of shoes are out there. Obviously, if you're not taking care of yourself from a nutrition, if you're not staying hydrated, if your diet isn't on point, that could cause kind of deteriorating form, which could cause knee pain. Some anatomical considerations would be your ankle and hip. We'll talk about how the knee is kind of stuck between a hard and a rock, or a hard spot and a rock. Rock and a hard spot, that is. And that could be the knee. So we have to really look into the ankle and the hip. A lot of practitioners are just working with the knee, and I think they're failing you, because you need to take a look at the whole body, particularly the same-sided ankle, hip, and even the back. So we also want to just take a look at your overall alignment between the hip, knee, and the ankle. Glute, hamstring, and quad strength, so your overall strength and the balances between those, as well as the timing, the firing of the muscles, and some fundamental things that we need to just think about. What does your walking pattern look like? Has that been assessed? Or is your walking pattern poor, and that's leading into poor running form? I think it's an absolute must that if you haven't already, you need to have a running evaluation. This should be, it doesn't have to be the most technical thing in the world, but it's ignorant if your practitioner is not looking at that. I can say that because that's something we really take pride in, is taking a look at how you're running. You can't ignore the importance of even just your static posture, and orthotics from here and there can be helpful. So here's our approach. Yes, it may take hard work and energy and time to achieve your goals, but isn't that worth it if we can help save you from another surgery, if we can get you back out there running with your friends and just enjoying the freedom that comes with running? You know, we don't promise an overnight strategy, right? It may take 6 months. It may take 9 months, all right, depending on your history. But we are in it for the long run. And once we get there, we want to really kind of bulletproof your body for a long time to come. Okay, so I wanted to kind of walk through a couple of things of why do I have knee pain? Why the heck did this just kind of come out? Well, we've talked about a few things already. Specifically with your running form, I wanted you to think about this. Have you had any coaching changes? So for those of you that have a running coach that are a little bit more serious, have you changed your tempo, your stride? Have you had different thought processing in terms of your mental cues? As your body gets older, compensations can occur. So if you've been running with no pain for 10 years and it just started, what kind of compensations have happened? Have you changed your strike? So have you gone from a 4-foot strike to a heel strike, or from a heel strike to a 4-foot? That could be its own online educational workshop, to be honest with you. I will send you guys an additional video that I've created that I've found success with my runners. So be on the lookout for that. And first off, have you guys had it truly assessed by an expert? Have you had your knee pain assessed by an expert? Or have you just kind of YouTubed everything, which is almost a slippery slope nowadays? I caution you to do that sometimes. And running form, it can deteriorate when you're fatigued. Some additional running form miscues that I think you guys should know about. So this one right here, this runner happened to be too vertical. All right, they were just kind of bouncy. And you might know some of your friends, for those of you who are in social running groups, that were just too bouncy when they're running. So we corrected that with him and had to show him that he was even doing it in the first place, because unless you've had this assessed, you may not even know. This is what's called a crossover gait. So this person had extensively tight IT bands, and I think more than that, chicken or egg with tight IT bands. I think this person's running form was kind of that crossover gait, and that created their tight IT bands. But again, this person did not know that they were doing it. This person had an ankle whip. Okay, the fact that their ankle was whipping out to the side, that caused their inner knee pain. Had to let them know. We had to kind of correct with that. They had weak hamstrings, specifically the external rotator hamstring, so the bicep femoris. So we had to work on that, and that cleaned up that athlete. And then we also have the classic valgus, where the knee caves in. You might have heard about this term for those of you that have been in and out of physical therapy, or maybe even told that. But which one of these do you think is most common? That's right. So you've probably seen it and heard about that, but the most common that we see, that we correct with running form, is the valgus. And a couple of muscle imbalance scenarios that I want you to think about that may cause knee pain when running are, and these are just 4 of the top categories that we see. Which ones do you guys think is most common out of those? Are the quads just too tight with the hamstrings overpowering? Is it the weak hamstrings and overpowering quads? Is it tight calf muscles, so on and so forth? And yeah, so we tend to find, for me, the combination of overused and tight IT bands in combination with weak quads and glutes, particularly glutes. I don't have the data listed here, but I saw a study that if you can turn up your glute activation from 8%, which is the norm, to 14% just by specific different cues and mechanical differences in your running style, boy, that can significantly offload your knee. All right, and so this is just an example of someone pulling you into internal rotation due to the tight IT bands. So with regards to shoe wear and some environmental factors, we suggest that you change shoes every 4 to 6 months or every 300 miles. So for those of you that are running 20 miles a week or more, you're obviously going to need to kind of keep that in mind and change your shoe more than someone who's just nonchalantly running 5 miles a week. Generally speaking, for those who have a flat foot, we want a supportive, stiffer shoe. For those of you that have a high arch, you may want a more flexible shoe. That's textbook, but different shoe wear factories and different mindsets, and some of you want a minimalist shoe. I like to help everyone achieve what they want. So if you really want to wear a minimalist shoe, I'm happy to have that conversation with you and work up to that. But it might just be that. It might be work before you're able to do that without the chance of pain. And just something else I like to ask my athletes and those runners, what are you running on? Are you running on trails, track? Are you running on concrete? And have you ran on the same surface for years? I've had a few runners that have just continued to run on the same thing, for years, and it's good to mix it up, especially a softer surface if you're having knee pain. So, where's your knee pain at? And you guys can feel free to kind of type this in as you go. But I wanted to kind of walk you through just this anatomy model to kind of show you and what might be causing some of that pain. So on the inner knee pain, you have these 3 tendons that all kind of wrap in there. And that can often create what's called a pezanserine bursitis. These people tend to really respond well to ice early on because that is an inflamed area. And along the inner side, we have the MCL. So for those of you that have a medial collateral ligament problem, and there's also the medial meniscus. So some of you have played basketball in the past, track and athlete, and you've hurt the inside of your knee. And the medial meniscus or the MCL is common. On the top of the knee, I'm pointing right there because the quadricep is pulling up and those quads are too tight. So typically that client responds really well, in my experience, to loosening up the quad. It'll elongate the patellar ligament. So if you have too tight of quads, that can cause pain on the top or the bottom. On the outside, that's your IT band insertion. The patella can actually be off track, which is unlisted here, but could also cause it, as well as a lateral meniscus, whether the lateral meniscus is being pinched or whether it's being separated or it's being irritated. That's certainly a possible pain generator back there. And on the back of the knee, so again, some of those hamstring muscles come crossing back through there. The insertion of the gastrocs, I find probably one of the most common reasons that you're having back of the knee pain. And this is also an area of accumulation where there's swelling. So you got to keep that in mind. The popliteus could be a player. So some of you might have heard of that muscle. It's very small. But it could also be nerve irritation like we're showing here. Typically, I find that nerves are almost ignored with a lot of my runners. And so you do have a nerve that kind of courses around there. Actually, loosening that up can make a big difference. So what's our approach? I really want you guys to understand how we're able to still help people who have tried everything, it feels like. And yet we're still able to have a very high successful rate. I just want to give you a quick glimpse of what this might look like. I think it all really starts with a really solid assessment. Too often in the healthcare world, people are running in and out the door. They're spending 5 minutes with a practitioner, maybe 10. And even we've seen and heard some of our clients who've tried physical therapy as a quick 20-minute treatment and they're out the door. Well, listen, we might take 2 hours to gather data and as you see here, understand your story, go through some of these assessments, synthesize it, and then I like to do treatment and really see, did I change the pain in your knee? Can you feel a difference? And that's something I really take pride in. Can you feel a difference before you leave even that first visit or even the second one? And down here too, the diagnosis and education, that's really important to me. It's so important to me that you know what's causing the pain, that you feel good about the plan ahead, and that you can execute that. We want to make sure that we give you all the resources needed. We can actually record you. Here's an iPad picture, but we can record you in the clinic with your specific exercises, with the cues that are right for you to make sure you're not causing further damage and yet you do it the right way and in a way that's beneficial for you. And we like to kind of come together, align expectations, and say, all right, John or Carol or whoever, this is what we anticipate your program will be. And of course, it can change throughout the process, but I think it's really good to know before we get started, what kind of a challenge are you in for, right? Do we think this will be something short and sweet, closer to 4 visits over the course of a month? Most of our clients are in once a week. Or are we thinking more longer term? Do we need closer to 6 to 9 months? Of course, we don't see someone once a week every time, but down there in the strength and conditioning, you might have some serious strength deficits that you might need to make up. And so we're going to kind of give you more time to work on that. And so we'll see you less often as you continue to be working through your workout program. All right, guys, so I want to kind of give you a couple of ideas of some techniques. This is very brief, but this is a really nice deep calf release that I've done. I'll do nice and slow and rhythmic with it. I work from the bottom to the top. And then this is kind of a nice, cool, active variation. You can see their legs dangling off. I'm stroking from the bottom up, and they're getting knee extension as I'm stroking up like that. So that can be a really helpful way to help with getting into knee extension and help loosening up that insertional calf that I had mentioned earlier that can cause pain. It's just a close view of, I was doing some dynamic cupping with this person. And I like to kind of move it around. You'll see the cups like you remember a while back with the last Olympics. Michael Phelps, he had those rings. Well, that was because the practitioner felt it was best to just leave the cups. But I like to kind of move it around, and I get a lot more value out of that. It's kind of like if you're fishing, you're not going to just sit in one spot and wait for the fish. If you know that the fish are elsewhere, you're going to go there and gather them there. So we find that that's really great for blood flow and loosening things up as well. And you can't ignore the joint. Okay, so right here is just a quick example. I was walking this guy through a quick joint assessment, and right there, I'm giving him a great traction and gapping technique. Okay, so this really feels wonderful for you if you've got fluid in the joint. If it really feels tight, I've had a great response to that. And it really is just a nice way for those of you who even have a little arthritic changes to loosen that up. We need to address functional movement deficits. So if this runner over here, I guess on your left, he can't practice running like that because that's going to cause pain with the way he's getting that valgus. We even kind of measured that out. And for him, it took a few weeks using the mirror. He had no idea he was moving like that. He was all twisted and rotated. And it took a long time to help improve what we call his proprioception, so that he knows how to get into that proper position, which will translate well into running. And like we've talked about before, education. We need to answer all of your questions. In this example, we showed him this was where the pain was coming on the inside of the knee, and this is the difference that you're making. And we can do the same thing with almost any movement, whether it's your running, whether it's a running specific exercise that you're doing. We need to diagnose the problem based upon your movement that you're doing, okay? So yes, we do believe in dry needling. We get asked what's the difference between acupuncture and dry needling all the time. I like to go right after the spot that's tightest, all right? Wherever that trigger point is, that's kind of crutching down on a nerve, you're not getting blood flow through there, the calf's not firing well. I think that's where dry needling can come into play. We are a huge advocate of strength training, so we're able to partner up with Anytime Fitness so that we can have access to all their equipment. And this is an example of helping someone really learn how to squat well, which is just a foundational movement. And then from there, after we've mastered some initial strength training movements, we can kind of progress into a running specific plyometric move. This is just one example. Okay, there's 1,000, but I want you to know that we want our athletes to work hard. We want to progress them, and strength is usually a huge differentiator with that. We want to go the extra mile for you guys, okay? We're happy to work alongside your dietitian, your fitness professional, your running coach. We think that's the future. That's how the vision of this should be, or should have been from this entire time. Multiple practitioners working together to help you run and compete however hard you want to, without worrying that you're going to hurt this thing, without worrying that you're going to have to go spend useless time with your doctor and they just tell you to quit running. We are not about that, okay? For those of you that are paying, and I appreciate you guys still being here tonight. We still have a huge crowd with us, and I really appreciate you guys hanging around. It hopefully tells me you guys are getting some value. You can just type it in the chat if this has been helpful so far. And for those of you that are just in a lot of pain, I wanted to walk you through just a couple of things that you could do right now to hopefully decrease some of the pain. We really believe it as kind of a five-step process. I'm going to show you really the first 3. I don't really have time to get into 4 and 5. That'd be something that we can really progress with you if you choose to see that we're a good fit to help you with your running. But the first thing that you need to do is just desensitize your knee. Let's get some blood flow in and out. Let's flush out the system. Let's do some self-massage. And I like to do about 3 to 5 minutes a day. So as shown here, this is just an example of how I would do it. I like to prop up my knee and put a pillow just underneath it. This is showing on the outer knee, so the vastus lateralis or the IT band insertion. I'm sure for those of you that have that pain, they go, oh yeah, I know that's tight and that spot hurts. Don't kill yourself over this, all right? Just desensitize it and just loosen it up. So find the intensity that's right for you. The tennis ball is nice. It's a little bit softer and you don't have to put too much pressure onto it. The lacrosse ball is nice as well. You can add a little bit more pressure with that. And yes, I do believe in foam rolling for the purpose of desensitizing the area. You know, there's this huge debate with IT bands, could you elongate it or not? Well, I don't really care if I elongate it. I care about you getting back to running pain-free. And if I can help desensitize the tissue so that we can loosen it up, so I can strengthen your quads, improve your running form, then it's done its job. Some of you have asked, you know, ice or heat? Well, it could be both. At the end of the day, if you feel like you've got swelling, throbbing, inflammation in the joint, put some ice on it. If you feel like you've got tight muscles, tendons, muscle knots, or trigger points, you might better benefit from heat. But if someone really feels adamant to try something, I usually let them try it unless there's a red flag or something that tells us that they shouldn't be doing that at all. Okay, so I've also found, and specifically for top of the knee pain or bottom of the knee pain, or just in general, stretching the quad out can really help. So we just use a yoga strap here. We can even give you one if you come into our clinic. We'll give you one so you can get started. I like to do 10 pulls of these with a 3-second hold. I like side lying. Most of you could do this because you're not putting pressure onto your knees. A lot of you don't like to put that pressure. So if we'll get you side lying, we'll strap the around your heel and we'll kind of pull that up. And right here, you'll see I get right in line, right? So that's pretty good extension. My knee is right in line with my shoulder. For those of you that are a little bit more sensitive, you can see I don't go far as back. My knee's not as bent, and maybe you still feel a good stretch even at that position. So at that point, my knee was at 90 degrees and I still felt a good stretch. So here's what I was kind of joking about earlier, between a rock and a hard place, or hard, yeah, I keep messing that up. All right, so this is just a classic example. We need to address your hip and your ankle, okay, in order to really help you continue to move forward. So arguably the quad, specifically the rectus femoris, is a part of the hip, and so that's addressing the hip. And then if you're not already, this is a little classic. This is just a slight variation on how I like to do it, but loosening up your calves can also help loosen up your knee. That's in part because of the tight gastroc that crosses the back of the knee. So what I like to do, just make sure your foot's pointed forwards like the arrow just briefly showed. I like to really push my hands into the wall here, drive the knee back into extension and drive the heel down. And that's pretty good dorsiflexion right there. And so just kind of eyeballing it, that's the amount of dorsiflexion you want to do. And so just as runners, make sure you continue to stretch out your calves. I like to kind of prop up the inside of my foot, especially for those of you that have a flat foot. All right, crank that knee back there, get that into a nice stretch, and you might feel that stretch out in a different place as if you didn't have that towel underneath. So as a reminder, those are just 3 things in this early process. It's an example of what you could do to get back to 100%. We want to desensitize it. I like to loosen the hips and address the ankle, pretty much in that order, not always. And then from there, not shown, but we would definitely want to strengthen you and begin a running specific program, usually in the form of some very specific plyometrics. Hey, don't you like my little runners there progressing through the track? Isn't that like pleasantly to see? All right, so we want nothing more than you guys to get back to running again. So we've got a special offer for you. If you feel like you like what you've seen, if this model makes sense for you, I'd like to really offer you a $49 running assessment. And I just want to kind of walk you through what you'll get with that. So again, it's going to be a full hour where we really get to understand you and your problems, what you've tried. You know, we don't want to recreate the wheel. So you've tried something that hasn't worked. If you feel like you've tried everything, you know, I need to know all that. So I'll spend as much time as I need to talking with you. I'd love to get you on the treadmill and analyze you. I know some of you runners hate getting the treadmill, but hey, it's a good place to be for me to just analyze that and see how you're doing. We want to make sure that you really understand what the problem is, and we want you to feel a difference, if not before that first assessment, even before the second as well too. We want you to feel a difference as soon as possible. Okay, so it's just $49. If you click on the offer, we want to get you on a call first. That's because I want to learn. We want to learn more about you and what you've tried. That's going to only prepare us and prime us for that first visit, because if we can collect as much information on the phone, I'd love to be able to do some treatment before you even leave. That way we can just expedite and jumpstart this process and accelerate it. I have 10 spots available, but I probably won't even have that. I'm going to be honest. I think it's going to be closer to 5. So if you're really serious about this and you want to get back to running, take us up on that and schedule your call as you click that link. And as you're doing that and thinking about that, I just wanted to kind of finish up with a really great success story we had. This is Mike. He's a really serious runner, and he had been wanting to get back to performing marathons well and struggled with inner left knee pain. And this was kind of a fun picture I took with him after he did the Charlotte Marathon in 2019. He had a great score. And you know what I really loved? He didn't feel it afterwards, right? There wasn't that, oh man, I really had to pay for it. And so in fact, I even made this little video for him. I didn't get the award for like best marketer here, but I wanted to just kind of conglomerate all the video footage that I took from him as we worked with him, and I wanted to just kind of give you guys a little glimpse. So what is not shown here is I did a lot of hands-on work, kind of similar to what I'd shown you guys earlier. But I did capture some of the exercises just to kind of give you an idea of what that was looking like. And we worked hard. I worked him hard. He would kind of grunt and moan a little bit. We'd joke aside. But once we got him to the point where he decreased knee pain, we could really load it, which is key. It is even more key to get him strong, to really bulletproof his body. And he might even need, once a month, once every few months afterwards, just to make sure you're on point. And this was kind of our joke. I want him to get to his PR of 2:45 for that marathon. So it looks like we still have a bunch of people here, and I can't thank you enough for your time, for showing up tonight. I hope that it was really helpful. If you have any additional questions, or if you're not sure about something, just reach out to us. You can also connect with us on our website, primemovement.com. You can give us a call or check out any of our social media.